Good
Yeah,
evening.
thank you very much, Ankit, for the introduction.
Thank you,
Hello.
sir. Thank you. Can you
Am I-
introduce yourself? So we have Kimberly joining us from North Carolina, USA, and Will is from Australia, and we
Yeah.
are
Hello.
the
Hi.
United World. So we would expect a lot of insight from you,
So, Dr.
Sure.
Jane, do I say Sabu well here?
Dr. Sahab.
Sahab. Okay, Dr. Sahab. And Rakesh, good morning. Hi.
Hi,
Um,
Dr.
Hi.
Rakesh.
Explain to us a little bit about yourself, for the viewers this morning, and your background.
Dr. Jatin, can you able to hear us?
Its voice has been cut initially. Hello.
Yeah. So
Hello. Can you
can
please
you
come again?
tell
Yeah.
us about yourself, what do you do, and where are you from, so that our viewers would be knowing what you do and what you where are you from, and how you are working during this COVID thing.
So actually, I am an infectious disease specialist, and I just did my DM in fellowship in infectious disease around few months back from All India Institute of Medical Sciences, New Delhi, and currently I am working with the Max Super Specialty Hospital and one more hospital in the New Delhi area. So my core interest is in the transplant infections and the tropical infections. And since being an infectious disease specialist in the COVID pandemic time, I'm giving my time to these COVID patients also. So these are the patients who needs early detection by using your clinical skills, by your microbiological diagnosis early, and then keeping them home quarantine depending upon the mild, moderate, and severe in the the symptoms. So as far we are going through the lockdown phase, so far number of cases in our country is little bit less, but you never know because even a single case can be proved detrimental if can be if later on diagnosed on the very lately. So what we are doing it, we are doing it on an early basis, going through RT-PCR testing of the our patients who are coming with influenza-like illness. I mean the fever, cough, and a sore throat. Whatever reason could be of influenza-like illness, we are going through the COVID-19 testing, and if the patient is proven to be COVID-19, we are isolating that patient. Over to you,
So, sir,
Ankit.
what kind of patients and what kind of symptoms you are facing during the COVID thing? Because we have experienced that there are a lot of different symptoms in different countries, and that's why a lot of doctors are involved. So yesterday we had a doctor from Hollywood, and he's treating COVID patients, taking as all the asthma patients. Basically, that's how they treat to the asthmatic patients. So, what do you think about the symptoms, and how what should be the first way of treatment? Because there are a lot of experiments also going around.
So as we all know that there are certain groups of the patients like chronic, I mean the kidney disease, the certain lung disorders, certain heart disease patient like hypertensive, diabetes. They are the groups which we know that they are having the poor outcomes. But if we talk about the young and healthy patients, they are the one who present with the fever, cough, sore throat, and one of the very interesting symptom like the anosmia, the loss of smell. Also few patients are coming with the loss of taste also. These are the patients are the young healthy patient. And if you talk about the immunocompromised group patient, those are the ones who are getting into moderate to severe ARDS patient, I mean the severe bad lung disease or pneumonia, and also certain kind of arrhythmia in the form of ECG changes.
Okay. So when you talk about different patients with different symptoms, so that means they are coming from a different chronic or different illness or different maybe a different culture. I mean, how you differentiate between them? Because the treatment of Lyme is also different as while treating the patients, or I mean, because we have a lot of unanswered questions with our viewers and from us as well. That how should we take it forward?
So as far as the our Indian guidelines are saying that we need to our suspicion should be very high, especially we all are going through this pandemic. So any patient, I already mentioned that, who has a history of the coming in contact with the positive patient, I mean, who are laboratory confirmed patient, and anyone who's coming in contact with the laboratory confirmed case, or any healthcare worker, maybe he's asymptomatic or he's a symptomatic one. So those are the ones need to go to the testing, and based on those testing, we have to start our treatment part.
And we also heard a lot of news, I mean, lately from China as well, that they have reported new cases, and also some cases being infected on their brain as well. I mean, might be a brain hemorrhage or something which disturbs their mental level of thinking as well. Is it something parallelly going on in India?
Yes, there are, recently, even the New England Journal of Medicine has already published that the COVID-19 has impact on the neurological system. It could be central nervous system, it could be peripheral nervous system. Peripheral nervous system, which is one of the commonly affected in the form of, I already mentioned, anosmia, the loss of the smell, as well as the loss of taste. They are the peripheral manifestation of the neurological disorders. If we talk about the central disorders, then there are, the Guillain-Barré syndrome, the GB syndrome. The patient presented with a bilateral lower limb weakness, both leg weakness, and they are typical AIDP or Guillain-Barré syndrome patients, which we see in our neurological practice. So we need to be highly suspicious in terms of, a patient of GB syndrome coming in our emergency department. First differential diagnosis should be on our mind of COVID-19, especially if we are going to the pandemic 19.
Okay. And sir, are we on the right track in terms of the treating the patients in India, or do you think we need to do a lot more strictness? Because we have seen during, I mean, still the lockdown is extended till 3rd of May, but we are still getting a lot of new patients and new reported patients coming up in Delhi, in Maharashtra, and other parts of the India as well. So what should be the I mean, take away from what happened till now, and what are the plans for next a month or maybe 3 months?
Yes, we're already on the lockdown 2.0, already is going on, and today is the 5th day of the lockdown.
Yeah.
Second lockdown. So still we are getting the new hotspot areas. I mean, the hotspot area by mean in our country, a lot of new cases. I mean, those who have been coming in contact with the patient earlier, now they are getting the symptoms. So those are the ones who needs to be, strictly quarantined to their homes. And even if they require any kind of help, our government is providing help to their doors. Chap.
And sir, when you go to the hospital on regular basis and treating those patients, what kind of precautions you are, following yourself and for your family, because you have to come back to home and you have a family to take care of, and every day is like going to a war, and then come back as strong as you can, and mentally also, physically and psychologically. So because we are very concerned about the doctors, because they are the front runners for us at this point of time. I saw you yesterday, and I was not able to identify you today, basically. So I mean, how
that's a very
how you are preparing yourself?
That's a very important and very valid question at this point of time, because even if one doctor get infected, he can infect to the other patients. If he's going to the OPD, if he's going to the ICU wards, I mean, if he's going to the routine practice, he can infect his or her patients. So what he needs to practice is, he has to be wear proper donning of all the personal protective gears in the form of a goggles, in the form of a N95 mask. I'm talking about the healthcare provider like me. So the goggles, mask, and if you are going in an aerosol generating area, like patients who are undergoing the mechanical intubations, or patient ventilators, so you need to have the full gown, and that should be the affiliated through certain agencies which we have been designated, so that they should be not harming your body, and proper donning. And after that, while seeing the patient, and when you once you come out, you need to be proper doffing, because doffing are the step which has to be done very meticulously. You cannot touch your bare hands onto the outer surface of the gown, outer surface of the mask. you have to be extra cautious while doffing. Donning means putting on the personal protective gears, and doffing means, removing the, taking out of their personal protective equipments. So those are the steps which needs to be taken care while working in the hospital. While coming out to the hospital, you have to take care of your hands clearly, and then in the car, you need to again hand rub with the alcohol based hand sanitizer. And once you enter into your home, try to take out your shoes outside of your door, then come take a bath. Then you need to, meet your children or you meet your wife and all those things after taking a good bath with the soap and water. Those are the things which you have to practice. And all of your clothes has to be gone to the, hot water with a liquid soap, so that it can be also disinfected. So these are the practicing which we are doing it on a daily basis these days to prevent our and our family also.
Sir, we are concerned about this thing. We are concerned about your mobile phones, and we're concerned about the, how you manage your car as well, because those are also might be contagious while during the COVID situation. So how you handle your goggles, how you handle your beard, and how you handle your earphones and mobiles, that also, a way to spread the virus?
So for that, I'll say there are 5 P's for mandatory for everyone. One is the personal protective equipment that we need to have. Second is, if the patient is having the fever or cough, he should also be wearing at least a surgical mask or triple layered mask, as we say. Second, coming on to the P for phone or iPad. So as far as possible, try to avoid taking to the hospital. Try to keep your phone within the car only. And even if you're taking it, and the moment you come out, try to clean your phone with the alcohol based, with the cotton swab, with the alcohol based rubbing should be there. Third P stands for the personal belongings. Try not to take as much as personal belongings to the hospital, like carrying the female doctors carrying their bag and any kind of stuff, any books. So should be avoided in this pandemic time. Fourth is posting of the signs outside of your clinic, outside of your wards. There should be proper signs should be there. So what are the signs needs to be followed by your healthcare providers, and what are the signs should be followed by the visitors. I mean, those visitors who are coming to with their patients, what are the signs they have to follow. Last and fifth P is the pre-screening visitors. All the visitors, whether they are in the patient form or they are the attendants, they has to be pre-screened in the form of infrared to detect any temperature. And second is, if they have any fever, cough, they should first be sent to the flu clinic. So these are the 5 P's which I practice in my daily day-to-day basis.
But sir, while following these 5 P's, are you? Can we say that we are 100% secured, or we are 100% able to cover or shield ourselves from these viruses?
So there is no such 100%, because to err is human. So anybody can commit mistake in any of these steps. But by practicing all these 5 P's, we can minimize the contagious virus of transmission. We have to break this chain. That is our main motive is there, because you never know that a person who I am coming in contact, he later on turns out to be positive, or he can develop symptoms after 2 days. So for every patient, we have to assume that he may or may not be a potential carrier of the virus, and we have to follow all the 5 P's in our daily practice. So P for practice and all the 5 P's.
Yeah. And also, when someone is COVID positive, so what are the steps? What medical fraternity and government? Government is also helping you how to take it. But what are the precautions and steps a doctor carry once they know that someone is COVID positive and he is at his home right now? So how can we discuss the step by step monitoring, and how you bring that patient to the hospital, and what are the ways to treat them?
One thing is that, suppose if talk about me only, so if I develop these symptoms, I'm not a healthcare provider. So first and foremost step is I should inform the helpline number, and there has to be proper history given to the the any healthcare provider coming to our doorstep. We should not hide any information from our government, because government is already doing a lot of hard work to break the chain of this virus. So once the healthcare provider coming to us, they will take a history, they will filling our forms, they will be taking the our nasopharyngeal swab for going for the testing in the our any particular lab. And once they done with this kind of testing, being that in the meanwhile we have to be quarantined at our home, try to avoid coming in contact with any kind of non-immune person, I mean sorry, any susceptible person. Those who have not developed the symptoms, they should be quarantined and should be separated, and I should be quarantined in any different separated room. Second thing is that even if I turned out to be positive, so the persons who have coming in contact for the last 5 days or 10 days, they should also be screened in a similar way that when as I have been screened by the government of India. So the moment I turned out to be positive, so I need to watch my symptoms. If it's mild, I can be managed at home very safely. And the moment I develop the symptoms like any change in the shortness of breath, any kind of hemoptysis, any kind of abdominal trouble, any kind of again the CNS symptom, neurological symptoms, so I need to take the help of again the helpline number. I need to go to the designated hospital. If the government vehicle is not available, if government vehicle is available, then it's a good thing. You can be taken from your home and directly to the government hospital where you can be treated. Or even if the patient wants to come to the any private or corporate sector also, there has to be in a proper way. He has to be in a designated vehicle. He cannot come in by his own at own by road, by coming in own vehicle with the all the family members accompanying him, because it can spread to other persons also. So there are things which need to be taken care while managing a suspected patient of COVID.
So a lot of, lot of guidelines are for patients and for how to do the testing and how to monitor it and all those things. And you said that we have to guide the patient to follow the right step. What are the precautions for the family members of those patients? What kind of precautions they have to take? Because symptoms, that symptoms can start from day 1 to day 14, or maybe extended as well. So what are the symptoms the family members should follow? Because that how we live in India. I mean, we have joint families and we have so many people living under one roof. And if something happened to someone, how contagious is that? Because if you follow the news, what happened in civil lines today in Delhi, I think I'm not sure about the number. All the family members are, COVID. That's what the news is. I'm not aware about the treatment, but that is what the news is. So anything for the people who are near to who think that there is some symptoms, so they have to take some physical distance, and how they should do it, because that is what is our view.
You are absolutely right, Ankit. Definitely, this is a very big problem and big challenge to our country, especially the one to those families who are living in a single roof, and number of people are sharing a single room. Also in India, a lot of people are sharing. So if any of these symptoms develops in any of the patient, he can be contagious to other persons. So what they can do is they need to be practice this social distancing in terms of that going outside for the routine on without any need they are going out, so it should be avoided. So because even if they take the virus from outside, then the one person can infect the whole person staying in a single room. That cannot be changed. Persons who are staying in a single room, that cannot be changed. So better is to avoid going outside. Even if they're going outside during the lockdown period, they should be going with the face mask properly, whether it's a homemade mask or it's a surgical mask they are using it. Second thing is, if they are ordering something from outside or they're taking something from outside, try to clean those surface disinfection. I mean, touching the knobs or touching the door handles, they should be cleaned with soap and water or with the alcohol based hand rub. So those are the things which need to be practiced. Even at home also, try not to be in a very close contact, sitting in a very close face to face, they has to maintain a distance of at least 2 to 3 feet minimum. Better is to maintain a 6 meter distance or 2 feet, but it is advisable to maintain as much as possible, because you never know that anyone can cough, and he or she can transmit the virus to the partner or something, your kids. So they has to practice in the closed room. It's a big challenge for our country.
But you know that, I mean, whatever you have mentioned, that could be a ideal way for people living in metropolitan cities in India. What about people living in rural cities, villages, and small towns? Because their way of lifestyle and culture is way different from what how we are living in Delhi or maybe in Bombay or other parts of the metro cities.
So So in that context, I'll say that I think the COVID has taught us, not only the urban population, the COVID-19 has given the lot of information about the hand hygiene practice, about the facial hygiene practice to the the rural people living in the rural area of rural of our country. So rural people, they also know that we need to wash our hands with soap and water. If required, we need to cover our face with the mask if we are going out, especially. And because most of our rural people are engaged in the agriculture activities, so they may come
Yeah.
across with any positive person. So better is when they're going in the fields, they should be wearing the homemade mask if available to them. And second thing is that they need to be wash their hands, because they might be coming in any contagious surface. You never know that which surface is the contagious. So they need to practice the frequent hand hygiene, and they should be also be given the teaching in the form of the radio broadcasting is there these days. So they are in a usual habit of listening to those radio broadcasts. So what they do is
Yeah.
they listen to those things, and they also practicing even in their as small as rural villages there. So even their children also know this thing, that the coronavirus is in our country. To break the chain, we have to follow certain steps.
Okay, and I was going through your profile, and it says that the areas of interest are transplantation infections and tropical infections and travel health.
Yeah.
So, can you elaborate
Sure.
what are these terms for our viewers? Because we would like to know more about your interest and how, I mean, our viewers and patients can, I mean, reach out to you if there is some issues or symptoms they are facing.
So as I already mentioned in the initial part of my talk, that the patients who are, those who are having the poor outcomes, they are the ones who are having the underlying, organ dysfunctions in the form of chronic lung disease, liver disease, kidney disease. And over that if the patient is already undergone transplantation, the body is already immunocompromised with a lot of drugs which has
Right.
been given to the suppression of the organ. So those are the ones, even the symptoms developing in these kind of patients, you cannot there cannot typical symptoms. They can be
Yeah.
presenting in a bizarre of symptoms can be there. So those are the ones who need to practice the social distancing, hand hygiene, and all those things. Apart from that, my duty is to detect if the patient is coming to my clinic in my chamber. I should have a proper sign over outside my clinic that yes, you need to wear the mask. You need to hand rub your properly if you touch the any kind of surface. And the
Yeah.
third thing is, even if you have symptoms, before coming to the hospital, before coming to my clinic, call my my member, and he will be informing me. Yeah, he will be informing me that these are my patient who are having the respiratory infection kind of symptoms. So I
Yeah.
will be, my whole team will be more cautious in dealing with this kind of patients. Second, my expertise is in the tropical infections. So, as we all know that our country is a tropical country, we used to see a lot of tropical infections in the form of malaria, dengue, chikungunya, and
Yeah.
scrub typhus these days. A lot of scrub patients are coming these days. So they all can present along with side by side with the this COVID-19. As we know that these days we are having the mm, rainy seasons
Yeah.
about to come in the June July part of monsoon. So cases will again going to rise. Patient coming with febrile illness, we have to be very cautious. He could be malaria, he could be dengue, or he could be COVID-19. So we
Okay.
cannot miss that. Every patient, we cannot think that it is a COVID-19 only. If we keep
Yeah.
on looking at the COVID-19, we will miss the malaria part. That is easily treatable by the chloroquine.
Yeah.
So we have to be extra cautious. Third expertise, which I did it, I am an International Society of Travel Medicine member also. I am a travel health expert from US only. So my field in this is that to patients who are coming from the abroad to our country just for visiting travels and routine visiting our family members, those are the patients who need to be screened, on various strategical models. Like if the patient is having fever without any acute respiratory symptoms, they should be quarantined. If the patient is having fever and along with the acute respiratory symptoms, those are the ones who need to be go for the COVID-19 testings. So those things which needs to be considered maybe in the next few months, because till now, because of lockdown, no flights are working. But
Yeah.
over the next 1 or 2 months, as soon as the lockdowns opens up, so we have to be extra cautious with movement of our commuters. So we have to be
Yeah.
extra cautious. Yeah, yeah,
Yeah.
Are you
And Dr. Jatin,
finding,
as you mentioned, yeah.
yeah, yeah, yeah,
Yes, Kimberly.
yeah,
I
yeah.
was just curious, are you finding any one particular drug or treatment to be more effective than the other at this time? And could any of this be done to be treated at home so that the people do not have to leave their home and can be treated at home, almost like we do? I hate saying this, but like we do with hospice, sometimes we bring the treatment home. Unfortunately, hospice is more for people who are going to die, but is there something that you're finding that's been more better received?
So as far as the our Indian recommendation or Indian guidelines are concerned, so patients who are whether they are asymptomatic or they are symptomatic, but they should be on mild infection. So those are the ones our country is recommending the hydroxychloroquine these days. So hydroxychloroquine is a drug which is being recommended by our country to be taken either by the healthcare workers or by the household contacts. They can be taken as a prophylactically also. They can be taken as a prophylactically, 400 milligram on day one, twice daily, and then on once on a weekly basis. But if you are getting the symptoms, suppose I am the patient, I am getting the symptoms, and my symptoms are mild, I don't need to go to the hospital, and I am coming out to be positive. So I can be started on the hydroxychloroquine, but after the advice of my concerned physician. I cannot start my own, because you might be knowing that the hydroxychloroquine is a drug which is now being, not being used but abused these days because of the hype. A lot of articles have loaded about the hydroxychloroquines. So people start consuming of its own. So that can be, dangerous, lethal. So after the doctor's advice and after the EKG, that what is called ECG, to look for the any abnormality in the ECG. If it's not, then that can be safely given. So this is a drug which is our country is giving so far. Apart from that, patients are advised to rejuvenate his immunity in the form of you know uh, antioxidants. There is no harm, although there is no data from the COVID-19, but yes, we have the data from the influenza and other infections in the past, like pneumonias. So they can be of little bit help, like vitamin C and other vitamins like vitamin B1. They should be complemented with the hydroxychloroquine. There is no harm, but precautions to be taken is avoid using the drugs which can prolong the QT interval in the EKG, which can be, prove lethal if you are already taking on hydroxychloroquines. So our history should be very important when we are dealing, with the COVID-19 and patients is having the underlying heart disease or patients who are already taking those drugs who can prolong the QT intervals.
That's interesting.
So, yeah, sorry, please.
I'm curious, have you tried any of the standard respiratory treatments when people get asthma? Have you tried any of those, like the prednisones, the inhalers, antihistamines? Has that been tried yet?
So what we are doing in patients who are already asthmatic, we are keeping him and patient who are already taking those kind of inhalers like mid-dose inhalers, MDIs, or any rota caps, rota inhalers. We are telling them that keep continuing those inhalers. Then no need to stop them. Yes, if they are taking any kind of steroids, yes, we are in a judgment that whether they need to be stopped or they need to be supplemented with any kind of antibiotics to prevent the superimposed bacterial infections with the COVID-19.
Okay. Now, I was wondering, because we've heard some researchers talk that they have seen a significant difference in those who are receiving the respiratory medications, that they're doing quite well when it comes with the COVID-19, because COVID-19 does cause inflammation, right? It tears. The corona tears at the sinuses, and tearing causes inflammation. So they said that they've been finding significant progress in patients who have had already been taking the asthma and upper respiratory treatment. So I was just wondering if that's something that the world has been seeing as well, or are we just kind of strictly staying with the hydrochloroquine?
No, as far as hydroxychloroquine is concerned, I already mentioned that those are the patients who are coming out to be positive, and they may or may not be having the underlying, any comorbidity. Okay. But if you talk about any asthmatic patient, any particular patient, yes, they are already having the poor lung compliance, or those are the patients who are having the COPD, or the chronic obstructive lung disease. They are already having the lung compromises there, so they are the patient who need to be monitored for their vital capacity of the lungs. They can land up in the ARDS or severe pneumonia. Okay. So those are the ones which needs to be put on the oxygen therapy, whether in the form of a nasal prongs to avoid aerosolization, prevent aerosolization by the nasal mask. Nasal mask to be avoided. We can put on the nasal prongs. If required, a patient can put on the the BiPAP therapy, and that too again with a precautionary measure, because BiPAP therapy also generates the aerosols. So because asthmatic patients, we have data from the New York also. I think the patients who are asthmatic, they are the ones who are developing the severe symptoms of in the form of ARDS or severe pneumonia. So in that patient, we need to be extra cautious. That's the only thing which I say.
So is it your belief that the warmer weather and more humid weather is going to slow down the growth of COVID-19, or do you think this is a myth?
Yeah, that's a really very valid question. Might be the rise in the temperature could have some effect on the decline in the COVID-19. But if you look at the the host which is carrying the COVID-19, we are the patients are the host, and in the human beings the temperature is already 37 degrees Celsius. So it's not going to change. It's not going to change.
I didn't think so. Thank you for saying that. Oh my gosh, I have been saying, if it's the hot weather that's going to slow it down, then why is my body the host? Because my body's way up here. Thank you. Yay. So no, this is probably not good news, but we're learning so much about this, so we're not afraid of it, right? I think when you're afraid of something and you're panicked and you're reacting, you tend to see a bigger panic and it gets worse. I think we're getting a little bit closer to not panicking anymore and slowing down the growth curve. Are you feeling like that there's a flat line in the hospitals? Like,
can you please come again?
Maybe you can ask.
Yeah, can you please come again? The voice was cutting out.
So, do you see a decline now from the beginning to now? Do you see a decline in the amount
number of cases?
Yes.
Okay. Yeah. So if you talk about our country, and definitely we are the cases number of cases are creeping slowly and slowly. Since we are in the lockdown phase, so trajectory is under stable conditions so far. the number of cases are under control. And since with the lockdown, we not entering into the community phase of transmission. Still, we are in the the phase 2 or phase 3 of the transmission rate. We have the lot of patients who are coming positive, those who have a positive contact history. We're not seeing a patient who is random, coming comes out to be positive without any history of coming into contact. So phase 3 of WHO, which has been already been mentioned earlier, and World Health Organization divided into 4 phases. So third phase is still to become, in Indian picture, if we don't follow the guidelines as being recommended by us, the social distancing and the hand hygiene practices, cuff etiquettes, and apart from that, the wearing of this facial mask. So if we keep doing those practices, still we can avoid going our country into the phase 3 of transmission. So far, we have such a big country with a 1.3 billion population. We have around 60,000 cases so far. So still condition is under control, and I hope that this should be in under control only. I don't want to see the numbers in lakhs or in crores so far.
Okay. You've brought up some really good points that PPE is very, very important. Hygiene, again, is very, very important. But I think the thing that's helping your industry the most is by us staying home. Am I right?
Yeah, I tell you why. Because this virus is a very egoistic virus. We keep on saying in our, our family also, it's a very egoistic virus. So unless and until you don't bring this virus to your home, or this virus doesn't come by its own. So this is a very egoistic virus. You have to respect his ego. Ask him, you should remain outside only. Don't try to come and our home. So if we follow these simple precautions,
you mean to say that the virus is like a politician?
The virus is like
virus is like a politician.
Virus is like a politician. Yeah. I mean, more about the egos going around.
It's a very egoistic virus. These things comes in a century. We have observed this thing. Yeah, hello, Philip. So we have observed such a pandemic, large pandemic, after a very long time, and that too is a very egoistic virus. So if just by following simple steps, if we can satisfy his ego, it's better to follow the steps. There's no harm in following those steps. No, that is a free of cost treatment.
I love it. Thank you so much.
We also have invention of the coronavirus, against the coronavirus, and I'll just quickly show you the treatment. This is what we are offering.
Yep, that's the only pill. The only way to prevent is to stay home. It doesn't 100% prevent. We've learned this. A few people have claimed to have received the COVID-19 by getting packages, because I think we still don't know how far it carries, how long it lasts. I've been doing research of when the first COVID was discovered, was a long time ago. We don't know. We don't know the nature of the beast and how far it will go. We just know that each strain gets stronger and more powerful against the human. So I think staying at home is not a bad thing. I think it's allowed a lot of us to get closer to the families, right, Ankit?
Yeah.
That's what
closer. We've gotten closer over this.
Yeah, thank you very much.
And Willie, thank you.
Dr. Jatin, I have a question from our viewers that how soon we see normal, life in India?
Can you please come again, Ankit?
We can see normalcy in India. Are we still far from the normal life?
That's a very tough question which you have given to me. Well, the government is already on the track that from tomorrow, that is 20th of April, there are certain opening of these, like essential things which need to be, on the track as soon as possible. And there are certain small scale industries which needs to be reopened to maintain our economy also. And but with the with the precautions that those are the workers working under those small scale industries need to follow the all the strict guidelines by the government of India. And similarly, with the schools, gyms, and malls, they need to be totally shut down. They don't need to be open. I think down the line in the next 2 or 3 months. But those things which have a contribution towards our economy, they needs to be open. We cannot keep moving our country with the lockdown for a next 3 or 4 months. So that has to be open up, but with a precautionary measure.
And you're talking about internally to the one country, but we are a world that operates globally. And I know that what part of your practices is about travel medicine as well. Can you define to me, what do you think would be good stage processing to get back to international travel or just long distance travel in general? What are some good, what do you think our stages need to be? We don't need to do it now, but say 6 months to a year from now, how should we stage back to travel?
So I think the 2 days back, I have heard a news about that Emirates is planning to start the services of the, serological testing. So, these are the under trial things these days. So
Right.
after down the line in the next 6 months, there has to be certain policies from all the countries. Those are the hotspot areas. They need to be restricted travels, and those are the where the pandemic has been under control, and the travel is a prerequisite. Then in those cases, with the use of the again the all those measures like facial mask and maintaining the social distance, even in the sitting of the inside the cabin also, you need to be take extra precautions, and carrying all the time with the alcohol based hand rub in your pocket, or they had to be provided by the the international airlines, because you never know, you can coming in contact with the surface and that may or may not be contagious. But it's a long way to come. I mean, it's quite early to comment upon that, but I think those are the precaution measures which need to be followed. I think not over the next 6 months, but in the next few years also, because this virus will gonna stay in our community. Like influenza, this virus will not going to, we cannot say that after the 3rd May, our country lockdown will be end and virus is going back to the China. It's not going to happen. The virus is going to stay in our community, and we have to follow the all the precautionary measures over the next few years. We have to change our habits, although it's very difficult to change our habits which has been inculcating it for the last many years. But we have to change our habits. Similarly with the sorry, please.
No, go ahead. I agree with you with changing our habits, and I think part of it needs to reestablishing our immune system. I think that needs to be one of the most important habits that
I think your voice has been dropped.
We are talking about the immunity system. So do you think the immunity system play an important role while maintaining your day-to-day lifestyle, and also be kind of a shield for yourself to protect yourself from viruses? How good is your immunity level should be, to protect yourself from these kind of viruses?
Ankit,
because what we're discussing...
I can hear you.
Yeah, sorry. Voice is dropping. Yeah, now it's clear.
Yeah,
now it's clear.
So even I would like to ask you is that how important is the immunity factor in this current situation? And also there are a lot of viruses, roaming around. Maybe we have some more viruses like corona in future as well. So how important your immunity level will play in terms of creating a shield for you to protect yourself from the virus?
So this is, these are the questions which I get across on daily basis. That how I'm gonna prevent from coming in across this virus, or how long this, the pandemic will going to last. So my answer to this question is, sooner or later, you have to come across this virus, either in the form of a active infection or in the form of a vaccine. So since now we don't have vaccine, so what we want to do is we have to follow our precautions. Even if we come across with the virus or we get the symptoms, we have to be extra cautious about not to infect others. One thing. Second thing is try to maintain the healthy lifestyle. We are in the lockdown state doesn't mean that we don't maintain our healthy lifestyle. Try to
Yeah.
maintain the healthy lifestyle that have the totally impact on our body. Have a positive mindset, have a healthy lifestyle, and maintain a healthy diet also, because
Yeah.
immunity is the only thing overall that will gonna protect you from this virus. So I have only two things to say: immunity,
Yeah.
and the rest left on the God. So these are the two things, I and G. Immunity, that is yours,
Okay.
and G is the God. Only those things,
Yeah.
two things are gonna play a major role. So third is the, if
And
you
in
get sick
hospital.
and develop the severe ARDS, then only you land up in the hospital. And you already know that patients who are severe pneumonia and with the underlying comorbidity, they are having very, very poor outcome. So only two things: boost your immunity as much as drinking good hydration, good fruits, vegetables, and the last thing is have a faith in God and your immunity. Nothing else beyond that.
Those are
And wait for
great.
the vaccine.
Those are blessings.
One
That's great.
question, yeah, one question,
Dr.
Doctor.
Zakir.
I just came across a news item which said that the virus is now in three forms. That is COVID-19A in China, COVID-19B in the Near East, and COVID-19C in Europe and North America. So I was just wondering where India sort of came into all this, because
I think that
yeah, I'm just wondering if we know what strain is there in India amongst this A, B, and C. Just wondering. You may or may not have this information.
yes, I really don't have idea about this, the strains. But yes, India is one of the few countries who have the uh, proper genome sequencing of this virus. But
Okay.
if you talk about the between the virus, between the Wuhan virus, or if the virus in the New York or virus in our country, more likely it's one or same thing. Yes, since these are the RNA viruses, they have the tendency to mutate. They have the tendency to mutate, just like our influenza virus. They keep on changing their nature. But so far, I don't think so. I have any data or I have any idea about that this virus is something different from the other countries.
And
Thank
also,
you.
Dr. Jatin, one of the doctors on our show discussed that we can treat COVID patients while providing the same treatment as the asthmatic patients. What do you have to say about that?
You're asking to me, Ankit?
Yeah, yeah, yeah.
Yeah. So your question is how asthmatic patient can be treated if the
So
patient
basically,
comes up.
so we have some medications and some treatment lines for asthmatic patients. So a
Okay.
lot of doctors, or maybe one of the doctors whom we know, I mean, he was on a show yesterday, and he
Okay.
was saying that he is following the same treatment for the COVID patients as well because of the same respiratory issues. What do you have to say on that?
So look at the the asthma. First of all, we have to, any disease which we're gonna treat, we have to go under under the pathophysiology. Asthmatic is a condition in which the small airways, small to medium airways of our lung get constricted.
Yeah.
If you talk about the COVID-19, there is a pathophysiology totally different. It is the
Okay.
interstitial pathology. It is the interstitial pathology. If you look at the CT scan, there is a ground glass haziness, there is a reduction in the lung compliance. So if you go for the spirometry test, if the patient is having the pure, asthmatic, there is the obstructive airway disease. If you talk about the, the COVID-19, it's a kind of a restrictive lung disease. So restrictive lung disease means there is a decrease in the diffusion capacity of the diffusion of the oxygen. Uh, Exchange of the gases will be hampered. That is why patient of the COVID-19 going into hypoxic respiratory failure. So both the pathophysiology is totally different. One thing. Second thing is, suppose a patient of asthma superimposed with the COVID-19. So they will be having double insult. One
Okay.
with the obstructive airway disease, second with the restrictive airway disease. So those are the one going already with the reduction in the lung compliance, lung compromise already there. Patients going in a severe respiratory failure.
Okay. So I would welcome to our new guest. We have Dr. Philip Yu joining us from LA, and then Dr. Sabgu is joining us from New Delhi. We have Dr. Jatin.
Hello. Sat Shri Akal ji.
Hi. Sat Shri Akal, Dr. Jatin. How are you?
I'm fine, Dr. Sabgu.
Yeah.
So we've had a lovely conversation about general practices with COVID patients in India. I think they have such a great